So I'm Emily Edwards. I'm a postdoc in the B-cell differentiation laboratory in the Department of Immunology and Pathology. Yeah, so I work on primary immunodeficiencies. So they're a rare inherited disease of the immune system. And in these patients, their immune cells don't function adequately, so that means that they're more susceptible to diseases such as infections, as well as non-infectious diseases like autoimmunity, cancer, and gastrointestinal disease. What the problem with these diseases is that there's a low diagnostic rate, and in order to get a diagnosis of disease, you need to identify the rare causal mutation that's underlying disease. The importance of that is that once you identify that rare mutation, it dramatically shifts treatment for patients. First, we're trying to identify rare causal mutations in a bigger group of these patients so that we can then shift the treatment towards more targeted therapeutics or personalized medicine. And we're also, for those individuals that don't have a genetic diagnosis, we want to find biomarkers that will then identify those that are at risk of the non-infectious complications. So again, we can direct their treatment a little bit more targeted. So yeah, the real sort of awesome part about being on site at the hospital is that we get the access to the clinical samples. We have all our samples come from within a national context rather than having to ship samples in from internationally. Yeah, so coming here on site at the Central Clinical School, it not only allows you to do basic research, looking at the nuts and bolts of how different mechanisms work, but it also gives you access to be able to look at that in a clinical context. It means you put your basic research in the clinical context, and it means that it's more amenable to translation, so to be able to be implemented into clinical care. So we're trying to, for example, use the basic information and the clinical insights to mold them together to get better diagnosis, prognostic monitoring, and targeted therapy for primary immunodeficiency patients.